Venous disease, also known as venous insufficiency, is a long-term condition due to faulty valves in the veins resulting in blood pooling in the legs. Normal veins work by pumping blood back to the heart with the use of valves. As veins begin to stretch due to their elastic makeup, the valves do not close properly and blood isn't pumped effectively back to the heart, resulting in blood pooling in the veins. As blood begins to pool, the veins can become bulgy and twisted and may become symptomatic. Varicose veins are swollen, twisted veins that are located just under the skin and can be a result from an underlying vein problem with the great or small saphenous veins. They are commonly described as bulgy, rope or snake-like, twisted and enlarged veins that are typically the same color of the skin, but can also appear blue or green in color. Common symptoms include aching, throbbing, and leg fatigue, and can also cause swelling of the feet and ankles. Although not life-threatening, varicose vein treatment is highly recommended as it is a progressive problem and may worsen over time. Spider veins, also known as telangiectasias, are broken, web-like veins that appear as a red or purple color and can be seen on the surface of the skin. They are considered cosmetic and can be treated with the use of laser or sclerotherapy treatments. Sometimes, spider veins can indicate a deeper problem with underlying veins, and an ultrasound may be necessary to rule out further venous insufficiency. Although spider veins are considered cosmetic, they can sometimes cause painful symptoms such as aching, throbbing, itching, and burning sensations. Reticular veins are blue-green veins that are visible just under the skin. They typically do not bulge and can be directly under the spider veins. Reticular veins typically are not symptomatic, but in some cases can have symptoms such as aching, throbbing, or itching. Signs and symptoms vary from person to person, but can consist of aching, throbbing, burning, swelling, itching, darkening or discoloration of the skin, especially at the ankles, tiredness or leg fatigue, as well as restless legs. If left untreated, conditions may worsen over time and ulcers may form at the ankles. There are many different treatment options available to treat vein conditions such as radiofrequency ablation or endovenous laser ablation, which is the closure of a vein using heat energy, ultrasound-guided sclerotherapy, which is injections of a medication into the veins under the guidance of an ultrasound, sclerotherapy, which are injections of the veins that are close to the surface of the skin, ambulatory phlebectomy, where varicose veins are removed through micro-incisions, Clari-vein or mechanical-chemical ablation, where a tiny rotating wire damages the inner wall of the vein while a sclerosing medication is injected simultaneously, and compression management, where some patients opt to not have any treatment at all. However, the use of graduated compression stockings may help manage and alleviate painful vein symptoms. Compression management is also required by most insurance companies prior to approval of any vein treatments. Before treatment, you will be prescribed a pair of graduated compression stockings. You will use these after each treatment session, so be sure to try them on prior to the first treatment to ensure proper fit. You will also need to sign a consent as well as have pictures taken of the areas on your legs that will be treated. Each patient has a recommended treatment plan that is personalized based on their condition. Specific information will be thoroughly explained prior to any treatment, as well as sufficient time to answer any questions or address any concerns. After each treatment session, compression stockings will be applied and are to be kept in place for 3 days without taking them off. Some treatments require the legs to stay dry during the first 3 days. After the 3 days, the stockings are to be worn all day and can be removed for sleep only for an additional 7 days. Showering can be done with the stockings on and will only take about 30 minutes to dry. Walking is also very important after each treatment. Walking 30 consecutive minutes per day for 2 weeks after each treatment session is a minimum requirement. However, there are no restrictions on how far or long you can walk, as long as it's a minimum of 30 minutes daily. While the veins are healing, it is not recommended to do any type of strenuous workout such as squats, running, or lunges for 2 weeks after each treatment session, as the closed veins are still healing and any extra pressure may cause them to reopen. Again, walking is the best form of exercise after vein treatment. Also, traveling by plane is not recommended after treatment, and patients should wait 2 weeks after their last treatment to fly. For car trips longer than 1 hour, you should stop and walk for 15 minutes after each hour of travel to reduce the risk of any complications. Would you like more information about La Jolla Vein Care and the options available? Visit our website at www.lajollavancare.com to learn more. To watch treatment videos of actual La Jolla Vein Care patients, click on the YouTube link on the top left corner of the page. If you just want a written description of treatment options available, click on the Treatments link on the top right of the page. For before and after photos, go to the next link over to the right and click on the Results link to see the amazing transformation of patients treated at La Jolla Vein Care. Feel free to browse the website and look at our informative blog, as well as frequently asked questions, or to our Google Plus account for reviews. And if you would like to stay up to date with what La Jolla Vein Care has to offer, follow us on our social media. Our website is here for you to enjoy and for you to feel confident with the treatment options that may be recommended to you.